If you have rib pain or a condition called costochondritis, which is rib pain in the front part, you have the sternum right in the center, and then to the left and right of the sternum, you have this little piece of cartilage that articulates or connects with the rib, right? And so if you have pain in any part of this video is for you. So what does costochondritis mean? Costo meaning rib, chondro meaning cartilage, and itis meaning inflammation of. The first symptom of this condition is chest pain. So it can mimic a heart problem, but it's not a heart problem. You go to the hospital, you get your heart tested, comes out negative. So then they diagnose you with costochondritis and they send you home with a medication. So the primary treatment of this condition is some medication and sometimes steroids, maybe sometimes an injection. And of course, if you look this up on Wikipedia, it'll say unknown cause. Okay. They don't know. Well, being in practice for 30 years, I'm going to tell you what I found to be the cause. There's actually two primary causes. And I'm going to talk about number two first. And that involves an old injury to either a rib on the front of your chest cavity or more likely a injury in your back part of your ribs or the spine through your thoracic spine, your mid back. I can't tell you how many injuries I had to my mid back. I mean, in football practice, people, you're knocking the wind out of you, slamming into your rib cage from the back part, to wrestling injuries. One time I was in college and there was this guy who said he was a karate teacher, right? He was going to teach us karate. So we got a group together, went to his house, went into his garage, and he basically used this as a punching bag. So we were to hold this little bar on top of our heads, and he was going to toughen us up. So he would then punch us, okay, in the rib cage. And so I was next. I stood up there, and I was supposed to exhale as he punched me. And as soon as he punched me, he broke a rib. Okay. I felt it crack, sharp pain. I'm like, dude, what are you doing? Like, you just broke my rib. So that was the last time I ever went back to that guy and found that he knew nothing about karate or any martial arts at all. So in the past, I have broken several ribs. And so when they heal, they take a long time. Okay. And if there's some type of broken rib or even damage to your thoracic spine, the scar tissue that develops takes a long time. So it's delayed. So sometimes this pain on the front part of your rib cage can happen months or years after you had injury in the back part. You have to realize the whole rib cage is connected. The back part is heavily anchored to the spine with a lot of scar tissue, and there's a lot less connective tissue on the front part. So a problem in the back part can easily create problems in the front. Okay. I'm talking about pain in the front part of your sternum. And so if you're so focused on the symptom up here when the problem is back there, then you'll never correct it. But this problem in the rib cage can really affect your breathing. It can create air hunger and breathing problems. And I just did a video on that, and I'll put that link down below. It can also affect the ability to expand your chest when you're sleeping at night to get air, and it can greatly reduce your ability to sleep and just get in a comfortable sleeping state. But a lot of problems with the rib cage happen really because of the spine and the back part. It can happen from the front part too, but usually from the back part, the thoracic spine. Now, it can also happen from unilateral sports, so whether it's golfing or baseball or tennis or any sport that involves either a right hand or a left hand activity, because you're repetitively doing the same motion over and over again, it can actually twist the spine and throw off the ribs and definitely affect your thoracic spine. Not to mention all the postural things, the people over their computer hunching over and what that can do to your spine. I'm going to show you some great things that you can do to correct that problem. Another side note on this rib cage issue, if it's on the right side, okay, lower right side, suspect gallbladder. I have a lot of videos on that. But if your gallbladder is congested, not necessarily a gallstone, but just congested, that can create a backup of bile and cause pressure into your liver, and that can put pressure on the rib cage, and sometimes even in the back part on your rhomboids in the back part over here, and especially up here. The number one cause of costochondritis is a vitamin D deficiency. Let me explain. Vitamin D deficiency in children is called rickets, and many times a child will have structural malformations from this vitamin D deficiency, like bowed legs, like kyphosis, which is hunchback, or lordosis, which is swayback, or even scoliosis. So, vitamin D has a lot to do with the formation of your skeleton. Also, if a child is deficient in vitamin D, they can have structural deformations that happen with their sternum and the related cartilage that's connected to it. In fact, the cartilage actually can grow more than it should and create all sorts of imbalances just from this vitamin D deficiency problem. Then, on the flip side, when you are older and you become deficient with vitamin D, you develop osteomalacia, which is softening of the bones. And you can also have problems with the sternum and tenderness and bone pain when you press into it, as well as the cartilage right next to it. And it's not uncommon to develop costochondritis from a vitamin D deficiency. Very simply, you just need to take more vitamin D, especially if it's in the winter and you can't get it from the sun. I would recommend no less than 10,000 IUs. Make sure you also take it with the K2, and then the ratio would be 10,000 IUs of vitamin D3 and then 100 micrograms of vitamin K2. And you want the MK7 version of that. If your costochondritis is really coming from this vitamin D deficiency, within days, you should feel relief. Let me come back to number one that I talked about, a thoracic spine or a mid-back problem that's then causing this rib pain. The thoracic spine that's involved in this, usually there's old scar tissue from some injury of some sort. And for me, I had a lot of scar tissue even in my 20s because the combination of a bad diet and old injuries was not good with my thoracic spine. So I have a lot of scar tissue in that area. I have degeneration, I have arthritis, etc. So I do what I'm about to show you to my thoracic spine on a daily basis to keep it stretched out. I found that I can't get an adjustment anymore because there's too much arthritis and it hurts and it's not the right thing to do because the problem is not necessarily in the joints of the spine. It's actually in the articulation between the spine and the rib. Okay. It's all the scar tissue around that area, which chiropractic doesn't seem to help with an adjustment, but only stretching will help that condition. And on top of everything else, guess what is in your mid back? Okay. Your thoracic spine, the guts, the heart, the core of your sympathetic nervous system. Okay. That's where it's located. And so these exercises that I'm going to show you are going to create a profound effect on your stress and your ability to sleep and feel relaxed. When you do these exercises, you're going to feel like you want to take a nap. Why? Because they're relaxing the tension in your mid back that's associated with this activation of the sympathetic mode. So I do this technique every night before I go to bed. And it involves this massage tool that I developed. You can see that there's different widths, right? Okay, the wide, narrow, and the medium, okay? And this is designed from my thumb. You can see my thumbs are huge, right? So when I would work through people and work on the thoracic spine, I would do this manually, but I developed this for myself to do this on my back. Now you're going to be using, if you use this, the wide portion right here. Now you can also, if you don't have this device, you can just have your partner or someone that you know in the house do this to you and start pressing on the rib head going outward at each rib going up the spine, okay? And really hitting those points that are really stiff and filled with scar tissue. You can do that. Um, this is nice if you don't have anyone. And I'm going to show you how I lay on this and I use this to relax and stretch the scar tissue that has developed from my old injuries in my thoracic spine. Okay, we have this device here. You can see the width here. And I'm going to put this, start lower in my thoracic spine. Okay, I'm just going to lay on it right down here, like so, right on this point with my head, the pillow right here. So I'm just going to lay on this for like, I don't know, 30 seconds. If I don't fall asleep. And I'm going to lift up and I'm going to push it up a little bit higher up, lay down on it. And both of those little prongs are on the articulation between my ribs and my spine. So they hit the points. They're relaxing the muscles. They're opening up that scar tissue so I can breathe better. And I'll slowly bring it up to the a higher point in my thoracic spine. So I'm laying down right here and here. And so I'll lay on this, and sometimes I'll literally fall asleep because it's so relaxing. So I do that every single night before I sleep. Okay, we're back. A couple more things I want to mention. There's something called the mobility stick, which I just discovered. It's a great, simple tool that you can use to stretch and rotate your mid back. As you can see, that I'm demonstrating right now, there's all sorts of different types of exercises that you can use with this tool to stretch and rotate your spine to put symmetry back into the spine. It's a great thing to help stretch it, and it actually will open up your rib cage and it will help you sleep. Now, there's another thing you can do with extension type exercises. As you can see in this video, this person is stretching their thoracic spine. All you need to do is do this with some type of like a bed or a bench, and start stretching that mid back to create some motion into the spine. Because the thing with scar tissue or arthritis is the key thing is motion. You have to keep it moving. You have to keep stretching it, because that scar tissue is like crabgrass and it starts to tighten up and it starts to affect the rib cage and your breathing. Now, because of the censoring and the suppressing of the algorithms on YouTube, it's becoming more difficult to find my content. And there's a lot of content that I cannot put on YouTube, unfortunately. So, to make sure you have full access of all my information, go to drberg.com and subscribe to my newsletter by clicking the link down below in the description. I will see you on the other side. Now, since I did mention this word stress, if you have not seen my acupressure technique for stress, you have to check it out. I put it up right here.